Health workers' unions have maintained that they will go on strike on the 14th of July 2023 over what they have termed as unwillingness by the government to engage them on their terms. Led by their unions, the health workers saying that they have given the government enough time to address issues in their collective bargaining agreement with no solution in sight.
With barely 14 days to the lapse of the 60-day strike notice issued to the Ministry of Health and county governments by the health workers' unions, the unions are decrying what they have termed as lack of effort towards the finalization of their collective bargaining agreement.
This unresponsiveness has been the norm and the greatest saboteur to harmonious working relationship between the unions and the Ministry of Health and the counties.
The strike is on, and to tell our members that they should prepare, as well as Kenyans, that from the 14th day of July, there will be no nurses, no clinic officers, no nutritionists, no pharmaceutical technologists, no public health officers, no laboratory officers in any of the public facilities across the country.
While calling for the prioritization of the health sector, they are calling for the employment of the 20,000 health workers as promised by the government.
We need to have the 20,000 being actualized so that we can have our members' employment being done across the board.
They also want Nakuru County to absorb all health workers who have been working under county-based contracts.
Those clinical officers and nurses who are employed by the facility, they account for more than 50% of health workers who are giving services there. So the moment you dismiss them, what happens to service?
Kufuta watu 500 ambao walikuwa wanapeana huduma katika hiyo county. Tunashangaa ni vipi au wananchi wa hiyo county watapokea huduma ya kutosha.
Recently, WHO came out with a plan that and a statement that healthcare are the people who are running away from their practice the most. And there is a projection that by 2030 we'll have lost like 10 million health workers because of poor condition. And Kenya is burdened with that.
The unions at the same time want the government to engage the public on how the enhancement of contributions to the National Health Insurance Fund will assure Kenyans of quality services.
Many Kenyans have challenges using NHF cards to access health services against the background of corruption scandals and scandal bedeviling the institution.
Nancy Okware, Prime Edition.